Hello, this is CARES. If you're caring for cancer survivors, you've likely heard this before. My treatment is over, but I just don't feel like myself yet. Emotional distress, fatigue, anxiety, depression, or low energy often lingers long after medical treatment ends. And while medications can help, many patients are looking for safe, empowering, and non-pharmacologic ways to feel better. Today, we'd like to introduce two well-studied interventions you can confidently recommend to your patients: mindfulness-based cancer recovery and Tai Chi, Qigong. In the 2025 MATCH study, researchers followed 587 cancer survivors who were still experiencing significant emotional distress after treatment. Participants engaged in either a mindfulness program or a Tai Chi-based group practice for 9 to 11 weeks. What they found was encouraging. Patients who took part in mindfulness-based cancer recovery experienced meaningful improvements in mood. Their tension levels dropped by an average of 2 points, anger levels by just over 1 point, and feelings of vigor increased by more than 1.5 points. These improvements were especially noticeable in female participants. Those who engaged in Tai Chi, Qigong also showed significant emotional benefits. Their anger scores fell by nearly 1.9 points, depression scores decreased by about 1.2 points, and vigor increased by almost 2.8 points. Notably, younger patients and those with more advanced stage cancer tended to experience even greater gains. Overall, both interventions produced small to moderate effect sizes, similar to what you might expect from a low-dose antidepressant, but without side effects. And interestingly, it didn't matter whether patients actively chose their program or were randomly assigned to one. Outcomes were consistent across the board. So how might you bring this into a busy primary care visit? It can be as simple as saying, even after cancer treatment ends, it's common to feel worn down emotionally and physically. Programs like mindfulness or gentle movement-based practices such as Tai Chi have been shown to help survivors feel more energized and less overwhelmed. You can find them in your community or even start at home with guided videos. As primary care providers, we often guide patients through their next chapter. Offering evidence-based, supportive options like these can make a real difference in long-term recovery. Thank you for the work you do. CARES is here to keep you informed, inspired, and equipped. If this was helpful, please consider subscribing and sharing with colleagues. We'll see you next time.